Hey everyone, welcome back to Study Acupuncture with me. So in this episode, we're going to go over the Yang Wei Mai, and we're going to go over the 3 clinical applications of the Yang Wei Mai, which are, number 1, it can treat intermittent fevers, number 2, it can treat the sides of the body, and then number 3, it can treat ear-related issues. Now, to understand these clinical applications, we have to talk about the Yang Wei Mai as a whole. Now, the Yang Wei Mai is also known as the Yang linking vessel, and that's because it actually links all of the Yang channels. Now, just like with all the other extraordinary vessels, the Yang Wei Mai also has an opening point and a coupled point. Now, the opening point and the coupled point can be used to activate the Yang Wei Mai. Now, the opening point of the Yang Wei Mai is Sanjiao 5, and the coupled point of the Yang Wei Mai is gallbladder 41. So now, let's look at a diagram of the Yang Wei Mai, which, as you can see here, the Yang Wei Mai, it starts with UB63. So it goes from UB63, it goes to GB35. And where's GB35? It's on the side of your lower leg. The Yang Wei Mai also goes up the outside of your thigh along your IT band. It goes up to GB29. And GB29 is one of my favorite points to needle for hip pain and for IT band pain. Now this point is located halfway between your ASIS and your greater trochanter. And then from GB29, the Yang Wei Mai goes up the side of your abdomen. It actually goes below your armpit and it goes to your shoulder area. Now in this area, the Yang Wei Mai does a lot of zigzagging back and forth, and it goes back and forth between points on your Sanjiao, your small intestine, your large intestine, and your gallbladder channels. So the Yang Wei Mai shares points here with Sanjiao 13, Sanjiao 15, small intestine 10, and large intestine 14. It also shares points with gallbladder 21. Now, from there, the channel is going to go up the side of your neck and it's going to go behind your ear. Now, here's where the Yang Wei Mai is going to finish off its pathway. So it's going to go from GB20 all the way to gallbladder 13. And this pathway that I just talked about is actually referenced from Maciocia. Now, if you're looking at Deadman, you might notice that there's a difference between Deadman and Maciocia, which we're going to review that difference right now. So here's a side-by-side of the points from Maciocia and the points from Deadman, which from Deadman, we do have more points here. And we have some points that Maciocia doesn't reference. Like, for example, Deadman has do 16. It also has do 15. There's also stomach 8 there. Now, Maciocia doesn't have those points. Maciocia has gallbladder 29. It has LI 14. And it has Sanjiao 13. Whereas Deadman doesn't have those points. And if you look at the ear area, Maciocia goes behind the ear, and Deadman, where does it go? It goes in front of the ear. So the question is, should you be stressed about this difference? And the answer is a resounding no, because the board exam is highly unlikely going to dig itself into a hole by asking you a controversial question like this. They're not going to ask you to delineate the differences between Maciocia and Deadman, because if they do, they're going to receive a literal ton of emails, phone calls, and letters about how, hey, Deadman says this, or Maciocia says this. So the board exam isn't trying to get themselves into any trouble in this way. So take a deep breath, relax, and let's move on to talking about the 3 clinical applications of the Yang Wei Mai. Starting with number 1, the Yang Wei Mai can be used to treat intermittent fevers. So the question is, what is an intermittent fever? Now, an intermittent fever is a fever that goes up and then it goes back to normal. And then after some time, the fever goes back up again. So the Yang Wei Mai can be used to treat this kind of fever, which is an intermittent fever. Now, the Yang Wei Mai can also be used to treat alternating chills and fevers. Now, you might be wondering, what's the difference between an alternating and an intermittent fever? And the alternating one alternates back and forth between fevers and chills. So it goes back and forth between the 2 states. There's a state of fever and there's a state of chill. There's an actual flip. Intermittent fever, on the other hand, it just goes from fever and then back to normal. And then after some time, it goes back up to fever and then back up to normal again. It's intermittent. So the Yang Wei Mai, you can actually use it to treat both intermittent fevers and alternating chills and fevers. Now, another thing we know about the alternating chill and fever is that it's the cardinal sign of the Xiaoyang stage. The Xiaoyang stage is a stage in the 6 stages theory. So in the Xiaoyang stage of the 6 stages theory, primarily what you're going to see is this alternation of chills and fevers. And why this is happening? It's because the pathogenic factor is halfway between the interior and the exterior. And we know that when the pathogenic factor is fully in the interior, that's when we're going to see this appearance of signs of heat, and we're going to see a disappearance of the complaints of cold, which you see this with the Yang Ming stage of the 6 stages theory. All right, now clinical application number 2 of the Yang Wei Mai is that you can use it to treat issues with the sides of the body. And this is really apparent when you look at the pathway of the Yang Wei Mai. So besides using Ashi points, you can also use the opening point and the coupled point of the Yang Wei Mai, especially if your patient's presenting with issues like pain on the sides of their body. So some examples of pain on the sides of their body are things like IT band syndrome, osteoarthritis, degenerative disc disease, or maybe they have kidney related issues, which with all of these, it's always a professional idea to refer your patient to their primary care or even a specialist if you're finding that they need further evaluation on their complaints. All right, now lastly, we have clinical application number 3, which is that the Yang Wei Mai can be used to treat ear problems. Now, ear problems, it can range from ringing in the ears to deafness, to pain in the ears, or any other ear-related problem. And this is because of the pathway of the Yang Wei Mai, which we saw before. In Maciocia and Deadman, it says it goes towards the ears. It goes past the ears. One of them, it goes in front. One of them, it goes behind. But the point is that it allows you as an acupuncturist to treat the ear. And you can use it to treat the ear with any of those shared points that we talked about before. Or you can simply activate the Yang Wei Mai through the opening and coupled points. And here I want to mention it again because we as acupuncturists, we are part of the medical community. So when it comes to the betterment of our patients, it's always a good idea to have more clinicians weighing in on any unclear presentations. So for example, if your patient is presenting with those ear-related problems, one of the first questions that we need to ask them is, have you seen your primary care physician? Or have you seen an ear, nose, and throat doctor? And if they have already, I would, as a professional courtesy, ask your patient to bring in any workups that that doctor did, because this could include vital information for your treatment. Now, another professional action that you can take is to keep that primary care physician or that ENT doctor updated on that patient's progress in acupuncture. Now, how do you accomplish this? You can accomplish this through typing up of a one-pager of your findings. Now, that could include your evaluation findings, the treatments that you did with the patient, any objective measures that you're taking with your patient that can show progress with their treatments. And you can share this with your patient and they can provide it to their primary care physician on their next checkup. Because remember, we as acupuncturists, we're part of the medical community. So communicating with their primary care and them communicating back to us is a professional courtesy. And that actually brings us to the end of this episode on the Yang Wei Mai. So as always, until next time, God bless and happy studying. Oh, hey, you're still here. Well, while you're here, let me tell you about today's sponsor. So today's sponsor is Poo Tea. Poo Tea is a hot and cold pain relief oil product, and right now you can get all of their products for 50% off. Just use code SAWM at pootee.com. That's POUTEE.com.